So today we're going to be focusing on the endocrine system. The endocrine system is, of course, a high weighting therapeutic area for the GPhC registration assessment. And we're going to be focusing on 8 questions for the endocrine system. So this is the first question. You have a 30-year-old patient that is diagnosed with primary hypothyroidism. She is started on levothyroxine. What is the primary monitoring parameter for adjusting the dosage of levothyroxine in this patient? Let's share your answers over here. So the correct answer was thyroid stimulating hormone, TSH levels. Can anyone give me some more information about how often you would check TSH levels if a patient's newly commenced on it for primary hypothyroidism? Yep, so I've included the extract from the BNF. So consider measuring the thyroid stimulating hormone, the TSH levels, every 3 months until a patient is stabilized. And then once a patient is stabilized, so if they have 2 similar results within reference range, 3 months apart, then it can be yearly. Okay, let's move on to the next question. The patient is a patient with type 2 diabetes is prescribed metformin as part of their treatment regimen. Which of the following adverse effects is most commonly associated with metformin and should be discussed with the patient during counseling? So there's something that is tending to catch a few of you out. So read the question carefully with this question. Okay, let me share the results. So for people who answered C, why did you answer C rather than E? So people can help me out. It's the common. Yeah. So the most common adverse effect associated with metformin use is gastrointestinal disturbances. And what would you counsel a patient on with regards to the GI disturbances? I mentioned this in our previous session as well. Yes, that is transient. If a patient doesn't know that it's transient, it tends to occur only at the start and it tends to get better over time. If you don't know that and you start this new medication, the likelihood is you're going to stop taking the medication. And it's also important, as Nafisa said, is to take the medication with food as well. Absolutely. Okay, let's move on to the next question. A 45-year-old man has type 1 diabetes, experiencing frequent episodes of hypoglycemia. He's adhering to his insulin regimen. He takes his rapid-acting insulin 45 minutes before eating. Which one of the following changes is most appropriate to help manage his condition and reduce the risk of hypoglycemia? Okay, I'll wait for a few more people to vote and then we'll go through it. Right. Okay. So it looks like most of you have put down C. Adjust the time he takes his rapid acting insulin. What do you think's happening here with this patient? With regards to today's session, all recordings are for members only. So the recordings are for members only, unfortunately. Yeah. So ideally, with rapid acting insulin, so most people take it immediately before their meal. If you're going to take it earlier, you'd advise 15 minutes with rapid acting. But not 45 minutes. 45 minutes puts the patient at risk of hypoglycemia um, prior to them actually eating. So immediately before meals for rapid acting, for short acting or soluble acting insulin, that would be like Humulin S, for example, that would be 15 to 30 minutes before food at least. But 45 minutes before it is essentially working out as too early for this patient, and that's why they're having hypoglycemic events. Okay. A 60-year-old woman with a history of osteoporosis is being evaluated for the pharmacological treatment to reduce fracture risk. Which of the following medications is classified as a bisphosphonate and is commonly prescribed for this purpose? With regards to the recording from the 29th, I don't think they've uploaded it yet. So it's once more the Morph team upload it. So the Morph team are responsible for uploading it. So I'm guessing give them until Friday at least, but it should be uploaded by then. Okay, let's go through. Yeah, so in terms of bisphosphonates, from all the options that I've given you, alendronic acid is the only bisphosphonate from the options that I've given you, which is self-explanatory. So I'll go to the next question. So here you've got a patient with Addison's disease. It requires lifelong replacement therapy with corticosteroids. Which of the following corticosteroids is commonly used as part of the replacement regimen for managing Addison's disease? So you can see people are tending to struggle with this question. Okay, let's share the answer. So the majority of you put down hydrocortisone in terms of treatment. Why hydrocortisone? Hydrocortisone is the correct answer, by the way, but let's go through why. Why were you confident that it's hydrocortisone? Okay, so when it comes to Addison's disease, you need something that has you need a corticosteroid that closely mimics how cortisol works. Exactly what Ellie's just put. It most closely mimics cortisol's it most closely mimics the body's cortisol in terms of the way it acts. You need something that provides glucocorticoid activity as well as some mineralocorticoid activity. Fludrocortisone has minimal um, glucocorticoid activity. That's the only challenge with fludrocortisone. And that's why patients are given hydrocortisone because of that combination of glucocorticoid and mineralocorticoid activity. When I went through corticosteroids as well in a previous webinar that I did a few months ago, I also spoke about the fact that it's short acting and it has a very rapid onset of action, which gives you more flexibility when it comes to dosing as well. And for those of you who understand Addison's disease as well, you will understand the fact that Addison's disease can be life-threatening. So you need something that's rapid acting. So the problem with prednisolone is it's an intermediate acting glucocorticoid, and the challenge with using prednisolone in these circumstances is it essentially works too slow for managing a patient's Addison's disease. Okay, let's move on to the next question. Yep. For this, the correct answer, as both of you suggested, was C. So the way carbimazole works is it blocks your body, the way your body processes iodine, and therefore reduces the amount of the thyroid hormone that is produced. Back to your question, Jesse, with regards to Addison's disease. Addison's disease is when someone has a chronic insufficiency when it comes to adrenal hormone production. And disease can lead to adrenal crisis, but adrenal crisis is that acute phase where someone's has not got the body has not got enough cortisol to survive, and it's a medical emergency. This is where, as people were mentioning before, this is the circumstances where you may use IV hydrocortisone to have a very rapid onset of action and rapid replacement in terms of that lack of cortisol in a patient's body. Okay, moving on to the next question. A patient with type 2 diabetes is prescribed an SGLT2 inhibitor. Which of the following is an important counseling point regarding the use of SGLT2 inhibitors? With regards to no, what I was saying was if a person has Addison's disease, that means they essentially have a chronic condition where they don't have enough of a production of their adrenal hormones. In those circumstances, if a patient can and may develop adrenal crisis if they don't have sufficient replacement of those hormones, be it in the form of treating a patient with treating a patient with long-term replacement of their cortisol. Okay, so let's share the answer for this. So the correct answer here is B, to ensure adequate fluid intake to prevent dehydration with patients with SGLT2 inhibitors. How do SGLT2 inhibitors work? Yep. They essentially increase glucose secretion, um, and they do this by essentially trying to get more of that glucose excreted via the urine, and therefore patients are at greater risk of dehydration. So adequate fluid intake is important. When it comes to pancreatitis and oral antidiabetics, which oral antidiabetic is there a risk of pancreatitis? The gliptins, DPP4 inhibitors, so like sitagliptin, for example, and GLP-1s as well, absolutely, which is a very important consideration given the high usage of semaglutide for weight loss and people getting it via online pharmacies and not considering the risks. People think GLP-1s come without risks. So yes, so the correct answer is B, adequate fluid intake. Okay, a patient with type 1 diabetes is transitioning from multiple daily injections to an insulin pump. Which of the following insulins is most commonly used in an insulin pump for continuous subcutaneous insulin infusion? So, Nafisa, with regards to the question regarding Addison's disease, for most patients, it will be hydrocortisone. The only time you would use a fludrocortisone, so it wasn't fludrocortisone for this patient. The only time you'd use fludrocortisone is if you want mineralocorticoid replacement, and that's because fludrocortisone has very high mineralocorticoid activity. So that's only if a patient has aldosterone deficiency. But for most patients, it's hydrocortisone. The correct answer for that was hydrocortisone. And back to why hydrocortisone is preferred over prednisolone, is because it's much more similar to cortisol. So you can use prednisolone in some circumstances, but ideally you'd use hydrocortisone because it's much more similar to cortisol. Okay, it looks like everyone's confused with insulin pumps. I've got an insulin pump sitting here, and this insulin pump contains Fiasp. What type of insulin is Fiasp? Rapid acting, absolutely. It's or ultra fast acting, absolutely. It contains vitamin B3, which makes it work faster than Novorapid, for example, which includes the same active ingredient, which is insulin aspart. The correct answer for this is rapid acting insulin. Why would you want rapid acting insulin rather than short acting soluble insulin for an insulin pump? Yeah, better control. It works faster, and you want to mimic the strangely enough, when we were talking about cortisol, and you want to mimic cortisol with hydrocortisone, you're kind of doing the same thing with rapid acting insulin for diabetes. You want to mimic the insulin that's produced by your body if you're a non-diabetic. So you want it to be as rapid acting as possible. So those small doses that you receive every hour as your background insulin mimic how quick insulin insulin acts for patients that are non-diabetic. So the fastest, the faster, the better. Naina, very good question. Which insulin is considered ultra long acting? Can someone tell me in the chat? I'm sure someone will know because I covered this. What's the longest acting? Insulin degludec, which is brand name Tresiba. Yes, it's degludec, as you put here as well. So when it comes to insulin pumps, the correct answer is D, rapid acting insulin, because you want it to be the fastest possible. And that's because your entire background insulin is being given by this insulin pump.